Within 2 weeks, over 2,000 cases have been recorded. Director of Public Health, the Ghana Health Service, Dr. Franklin Asiedu-Bekwei, says 168 cases were recorded yesterday, and wearing of face mask has dropped to 5%. Active cases have risen to 3,165.
I think that as stakeholders, we should meet and see how best we can address the situation. Ghana appears to have had a very stable situation of COVID. I mean, since like September, running up to October, and then up to November. I mean, as a country, we're recording less than 40 cases a day. The airport, we're seeing maybe less than 5 cases a day. Then come to the end of November, globally, there was a surge, increasing cases, and then at that instant, they detected a new variant. So our system that we have at the airport, we had our first few cases. There were about 34 of them, and still I would say that the cases were still low in the country. And then come early December, the situation changed. Now as I speak, the airport is recording in excess of over 100 cases a day, the airport alone. I think yesterday was 168. So, and also as a country, we are recording more than 400. The way it's going, I'll be surprised we're recording like 1,000 cases a day. So there's a different perspective to the whole COVID situation. Now having hotels to house the cases is becoming a big challenge. And the cases that are being reported in the country, about 90% of them is from Greater Accra region, 90% of them. Then you can have Ashanti and then a little bit in Volta region. So clearly, the focus is in Greater Accra. And if you want to look at how do we address COVID, it's actually two main ways. One is either you are using methods that do not use medicine, so we call them non-pharmaceutical interventions. So it's about the protocols. So it's about wearing the mask, it's about washing your hands with soap and running water, or sanitizer, or keeping the social distancing. And that has been our main intervention since we started fighting COVID. Then we have the second one, which is the use of the vaccine. But I can say that if you want to talk about the use of face mask, I'm sure we are recording maybe less than 5%.
Well, the Greater Accra Regional Security Council has directed the immediate shutdown of beaches within the region as part of strict and full enforcement of Executive Instrument 64 to address the rising cases of the infection in the country. About 96% of the country's current cases are in Accra, with more than 100 cases at the airports alone. The Regional Security Council is therefore convinced closing of public beaches is a drastic measure, which is a sure way to arrest the threat. Here is the chairman of the Greater Accra Regional Security Council, Henry Korte.
Ghana has recorded over 2,000 cases of COVID-19 within just 2 weeks. There has been a clear disregard for COVID-19 protocols. The Ghana Health Service says the wearing of masks has dropped to 5%. Government is worried. The Greater Accra Regional Security Council meeting brought together various stakeholders, including representatives of transport unions, event organizers, the media, beach operators, and religious bodies to discuss strategies to contain COVID-19 cases in the region. After a series of deliberations on strategies to curtail the spread of the virus, the Greater Accra Regional Minister, Henry Korte, called on the House to vote on the motion of closing the beaches before, during, and after the festive season.
So it is a pleasure of the House that after several deliberations on the rise in COVID-19 at the expanded Greater Accra Regional Security Council meeting, of which almost all stakeholders and institutions were represented, the decision is that with immediate effect, following from the directives of the National COVID Task Force, of which the President, the Commander-in-Chief of the Ghana Armed Forces, Nana Addo Dankwa Akufo-Addo, is in in charge, effective immediately, all beaches in Greater Accra region shall be closed now before, during the Christmas and New Year festivities.
The motion was carried through. Also, the various transport unions, including the Ghana Private Road Transport Union and the Progressive Transport Owners Association, were tasked to enforce the wearing of face masks by all passengers before boarding a vehicle. According to the new directive, any passenger who refuses to wear the mask would be driven out of the vehicle. The meeting also directed the compulsory wearing of face masks by all persons at event places. The minister has therefore tasked the Regional Security Council to ensure the full compliance of the directive. Mausi Nuwan's report for Joy News.
Saturday, 25th December, all passengers without face masks must not be allowed to board any means of public transport. 4. All persons moving in public places must ensure that they wear their face masks and observe all the COVID-19 safety protocols in public places.
And in Kumasi, the Komfanoche Teaching Hospital is on the verge of shutdown following the compulsory isolation of a number of its staff who have tested positive for the Omicron COVID-19 variant. Management says tests run on suspected cases in the past week came back 80 to 90% positive. Medical director of the hospital, Professor Bafo Kofi-Poku, is recommending call-off of all Christmas activities to minimize the spread. Love FM's Rasa Sasaridonko has more.
Symptoms range from severe body weakness, cough, severe headaches, runny nose, fever, and body aches. Data from the Komfanoche Teaching Hospital show negative cases for the month of November. But December has not been kind. Tests conducted on suspected cases this week came back 80 to 90% positive. Professor Bafo Kofi-Poku is medical director.
We have been recording large numbers of those who are suspected and then we test them. For instance, on Sunday, we had 14 suspected patients and 13 tested positive. The following day, we have 48 suspected cases and 37 were confirmed positive. So that's how fast we are recording the positivities. In the last 2 weeks, the positivity rate has been about 53%. But you realize that in the last couple of days, on some days, it's more than 90%. Compared to the same period in November, where we had just about 8% positivity.
Now, this is not reflecting in the number of admissions here at the infectious disease holding area of the hospital. Currently, there are just about 2 people on admission, but the impact is being felt at the emergency area and other sectors of the hospital. Doctors and nurses, health professionals here are getting infected, and by protocol, they need to stay away for 2 weeks in isolation, and that is affecting health delivery here at the only referral point in the Ashanti region.
Once you get infected, the directive is that let that person stay away for 2 weeks, recover before he comes back to work. We don't want any doctor or nurse transmitting the infection to patients or to other workers, and that's why the directive is there. But I think probably the ministry may have to revise that directive now and see whether now we can shorten the number of days, because a lot of our staff are getting infected. We are stressed, but we are doing our best. I only pray that we don't get to a situation where we may be compelled to say we have closed down the emergency unit.
Professor Kofi-Poku wants the public to adhere to health protocols and, if possible, call off all Christmas activities.
If you are in such a crisis, that is likely to drive a large number of our people getting infected. Why do we still want to hold them? I'm one person. If I had the power, unfortunately, I don't have that authority. I would have said all Christmas activities that are held indoors, church services, watch night services, what have you, should be suspended.
Authorities at the only referral center in Ashanti region will have no choice than to shut down the facility if they are not able to control the spread of the coronavirus on its staff. Reporting for Joy News, Erastus Asaredonko, Kumasi,